So now we have gone through and talked about what insurance is, how it works, and so forth. Let's talk about the actual plans, the way to get insurance in the United States. So as of 2015, there were about 319 million people in the country. Now, most of them were covered by private insurance. And in the pie chart on the left side, this is insurance coverage by type. Okay, and this is I assume this is the primary. This comes from the Kaiser Family Fund. So 56%, more than half, were covered by private insurance. 35% were covered by the government, which are Medicare, Medicaid, and then 9% were uninsured. When we look, though, at the expenditure by payer, so actually who pays the providers, you can see that despite the fact that private insurance taking up 56% of all, covering 56% of the population, they only pay 38% of the overall health expenditure. While the public plans, the government, pays over half. So that may seem a little strange. So basically the public is covering fewer people than private, but they're paying out a lot more. So their average costs are much higher. The reason why has to do with the people that are covered. So when you think about which government plans are out there, you have Medicare, Medicaid, S-CHIP, which is a Children's Health Insurance Plan. So, and they tend to be groups that are going to have higher costs of healthcare. Elderly, as you get older, you get more health issues, so you have to go to the doctor more. And then low income also is a high cost group, and that has to do with when we talked about the determinants of health. We said the number one cause of health is lifestyle. And so people who qualify for Medicaid tend to be or are low income, and low income tends to lead to an unhealthy lifestyle, okay? Because it's tougher to afford good food or better environments, so forth. So that's the trends that we're seeing here between private versus public. So let's talk about the sources of insurance. Right? So if you want to have insurance, these are the ways to get it. The first is employer-based group health insurance, and this covers roughly 35% of all people in the country. This is insurance that you get through your employer. They offer it to you, and they pay some portion of the premium, and you pay the rest of it. And it really varies by work situation. The laws have changed a lot in recent years about what the firms do and do not have to offer as far as this. But in general, the larger the firm, the more likely it is you're going to be covered. So this graph shows percentage of workers insured by firm size, and I'll say this is a little bit outdated. I believe this is as of 2012, so a lot of the provisions of the Affordable Care Act did not fully kick in at the time. But even then, you see that the smaller firm sizes, 1 to 9, 10 to 24, had much lower insured rates for their workers than larger do. But again, with the new laws, that has really changed a lot. It's much higher for all of them. So that's your group health insurance. Medicare is a government plan that is offered mostly to the elderly. So to qualify for Medicare, you either have to be 65 years of age and older, or satisfy or be disabled and satisfy the requirements. Now, Medicare doesn't always, it's not the biggest payer, but a lot of times it's viewed as the most important out of all the insurance plans. And the reason for that is a lot of times rules and regulations that get set by the government get set through Medicare, and that a lot of times ends up funneling down through all the other types for all patients, regardless of your insurance. So most of the funding for Medicare comes via a tax, right? 2.9% wage tax. Now, half of that, 1.45%, is paid by the employee, while the other 1.45% is paid by the employer. So, with Medicare, there are a lot of different parts to it. This table shows all the different parts of Medicare, the supplemental plans, but just to give you some a little more basic ones. So with Medicare, you have Part A, which is going to be your hospital. Now, Part A, it's out there, it's available. If you want it and you're eligible, you get it. Okay. Now, Part B covers physician care and outpatient. Now, unlike Part A, there is a small premium for that. So you actually have to pay to get that and any additional ones as well. Now, Part A and Part B, about 98% of the eligible population have both of those plans. Okay. Well, sorry, let me rephrase. 98% of people who are eligible and have Medicaid or Medicare have both. The other big one, there's a lot there, is Part D. And Part D is your prescription medication plan. Okay. It's relatively new, and it's an additional supplement plan that eligible people can buy and use if they need to, or if they'd like to. Medicaid covers 15% of the population, roughly, but but the coverage really varies by state. States that are lower income have higher amounts, higher income, lower amounts. And if we actually go, let me pull this up here, to Kaiser Family Fund, which actually has some really good information when it comes to healthcare. If we look at Medicaid, and we look at percent, and let's do select all. I'll show the map here. So this is the percentage of the population with Medicaid. Okay, and let me make sure. Yeah, and so as you can see here, you have a lot that are in the southern states, Florida, Texas, where the darker is indicating of the higher amount. Whereas up in the northeast region, especially up in New England, it's relatively low amount. And as of 2015. So then, Medicaid is funded both by the federal government and the state government. The problem with Medicaid is that, from a budgetary point of view, is that states where they have a lot of people on Medicaid, it can take up a large portion of their budget. So it can be up to, in some states, as high as 30%. Medicaid, it should also be noted, can supplement other types of insurance. You can have Medicaid and Medicare for that reason, and other types. Now, speaking of Medicare, and in general, this shows the breakdown of the population as of 2010, I believe. Yeah, 2010. And it shows total people with and without insurance, elderly versus non-elderly. And so if you look at the elderly population, you see they have a much higher insurance rate. Okay, much higher, a much larger percentage with insurance. The reason why is that they have that Medicare that's available to them. And about 93% get it from Medicare. Now, if you look down this column here, this column here, you'll see that there's a lot of, it adds up to more than 100%. So 93% for Medicare and 34% through their employers. 25% for other private. The reason why is a lot of people who have Medicare also have another type of plan. So that's not uncommon. Non-elderly is more of a mix. Now, a large portion either have it through their employer or a dependent, which is through their spouse's employer or parent's employer. Okay. And you see the uninsured rate is much higher for this group. A couple other types of insurance plans. You have SCHIP, State Children Health Insurance Program. This was enacted by Congress in '97, and it extended coverage for about 10 million children under the age of 18 without insurance. Some other government programs and charity. You have charity, about $80 billion a year, workers' compensation, Veterans Affairs. So all these are smaller ones. So the uninsured, let's talk about the uninsured for a second. The uninsured is always a widely discussed topic, and the rate has really varied over time. It's really varied. So as of 2012, I believe 16% of the population roughly did not have insurance. As of 2015, we're down to 11%. And so if we go back to the Kaiser health insurance coverage, we can see, if we look at the uninsured, and we can update this. Let's see. Update it. There. Okay. So when we do this, the chart looks very similar to the one we saw before with the Medicaid. And you see a lot of the lower states, New Mexico, Texas, Louisiana, Mississippi, Florida, having relatively high uninsured rates. And then, again, Northeast, West Coast, they have the lower ones. Now, these are also the areas where there's the stronger job growth, lower unemployment rates, lower percentage of population that are elderly. So all this in poverty, and all this really just kind of works together with that. So we've seen, as a result of the Affordable Care Act, we've seen the uninsured rate going down. Like I said, in 2000, table here, in 2000, as of 2015, it was 9%. 2013, I believe it was 13%. 2012, I believe it was like 16. And so what you've seen is, as a lot of the parts of the Affordable Care Act have kicked in, that uninsured rate has gone down. I believe it's down to, it's a different survey, but I think it's, some surveys have it as low as 7% recently. But we'll see how that is affected going forward. So those are the types of insurance plans. You have the government, you have private, and there's a lot of options within them. And then you have the uninsured. Now, the other thing to note about the uninsured is that the uninsured, more often than not, tend to be younger. And the reason why is, a lot of times when you look at uninsured or unemployment rates, they tend to be higher for younger individuals. And the reason why is, or not the reason why, But the result of that is a lot of times these people do not have insurance through their employer. So that's why you tend to see that. But overall, that's the main insurance plans that are out there.